Because grateful as I am for the overwhelming trust given to me by more than 1.1 million Cebuanos, I also deeply heartbroken for the true state of our beloved province. Gubot, Guba, Gutom, mauni ang among naabtad sa daghang suok sa suok. There are irregularities everywhere and lisod ni paminawon, but the people deserve to know the truth. Not from me alone, but from those who live through it. Across our 16 provincial and district hospitals, we walked into dilapidated, uncared-for hospitals, supply rooms that could barely be called supply rooms. Naay uban ospital, usara ka thermometer, naapay usara pud ang oximeter. In some facilities, patients had to pay for something as simple as cotton. The Department of Health's assessment showed glaring manpower gaps. Balamban needed 54 more nurses, Bugo needed 47, Karkar needed 38, Danao needed 65. Specialists were missing: surgery, pediatrics, OBGYN, anesthesia, some of the very doctors our people need most. And similar shortages in our district hospitals. Specialists were missing: surgery, pediatrics, OBGYN, anesthesia, and these are some of the doctors our people need most. For 6 years, the Provincial Health Board was not even convened. If it had been working, many of these simple issues could have been solved early.